My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have a guest, Nikhil Marathe, over from Juxtapose, who is a senior principal over there on the concept development team. So Nikhil, welcome to the podcast.
Yeah, thanks for having me. Great to be here.
Absolutely. So for all of our viewers and listeners that aren't as familiar with Nikhil as I am, Nikhil focuses on driving the firm's investments in platform-style private equity and inorganic growth builds in healthcare. Juxtapose is a creation-oriented investment firm building an industry transforming healthcare and tech businesses. Prior to joining Juxtapose, Nikhil was a principal at SilverSmith Capital Partners, a growth equity firm based in Boston, where he partnered with high-growth, capital-efficient businesses in healthcare. Prior to that, he was a healthcare investor at TA Associates, a technology investment banker at Evercore before that. Nikhil has served on many boards, within healthcare IT and services businesses, in payer, provider, life science ecosystems, also as a bachelor's from the Wharton School at University of Pennsylvania with concentrations in finance and management, and we're very excited to have you on. So I ask everyone who's in the healthcare business this, what inspired you to make healthcare your niche?
Yeah, it's a great question. I probably have a slightly different path into healthcare than many. I feel like I've either been asked this question or have asked this question a bunch over the years. And I often get the answer of my family, my dad was a doctor, my mom was a doctor, my entire family has been, in the healthcare world. And I just thought that was what I was going to do. And I actually have the complete opposite backstory. I don't have a single relative that is in the healthcare ecosystem. In fact, every single one of my relatives, family friends, in-laws are in the tech world. So I grew up in the Bay Area in the 80s and 90s, and right in the kind of center of Silicon Valley. So you could kind of throw a football and hit any one of these like dominant tech companies. And my dad was an engineer at Cisco for his entire career, and it kind of felt like that was the only career, the only industry that was that really existed, right? And I went to college and I started in investment banking and I became a tech banker because I guess that's what you do. But it was probably at some point during my career as a tech banker where just through like casual personal interactions with the healthcare ecosystem, I just started getting very bewildered. Like, how is it that we're advising these unbelievably innovative companies in the technology ecosystem that are creating these beautiful world-changing products across so many different domains, yet I still have to, get a paper prescription and like physically walk it to a pharmacy to submit it. Or of course, the one we always like to joke about is like we still run on faxes. I kind of thought like everyone's doing tech right now, but how is it that you can have this juxtaposition, no pun intended, the most innovative and the least innovative sectors kind of coexisting side by side. So it kind of piqued my interest in healthcare at that time. And then as I was thinking about, roles on the buy side, leaving investment banking, I kind of had this crossroads where it's like I had an opportunity to learn more about healthcare, an opportunity to learn more about software and internet businesses, and decided that was a great opportunity to really dive headfirst into healthcare investing and haven't looked back.
I love it. Depending on who you ask, this question is going to be different. But what I've heard over the many years I've been in healthcare tech recruiting is anywhere from 5 to 20 years before we see it in healthcare, we're going to see it in banking and consumer and finance.
Totally.
So I don't know which it's for you. Is it closer to 5 years? Is it closer to 20 years?
Probably closer to 20 years for me. But I think I'd probably default to like 10 years. Like healthcare is 10 years behind every other industry.
Like I'm excited to book appointments, for visits on my phone as easy as I can book an Uber. Or a restaurant reservation. Or to pay a bill on online banking, same type of thing. Like Why isn't it as easy to pay a hospital bill or provider group bill or a dentist bill or a chiropractor bill
Yeah.
as it is to just like pay your laundromat or to
Or
pay
even
your
something as simple as like having data access on multiple devices, having systems more interoperable. That's kind of been a thing for decades in all segments outside of healthcare, but we're still catching up.
I love it. Walk us through your experience at TA Associates, growth focused private equity fund managing 45 billion plus.
Yeah, it was an awesome experience. I started as an associate there. TA is a world class organization. Actually, kind of invented this idea of traditional growth investing. The history a little bit of the firm, and I might butcher this slightly, so I apologize to my former colleagues. But the firm was founded in like the late '60s, early '70s, and at that time, there were like venture capitalists and LBO firms. And there was nothing in the middle. And the founder of TA said, hey, why don't we call companies that don't need money and pitch them on why a minority investment would be accretive to their business? And, in the old days, it was like literally flipping through the yellow pages and like cold calling companies. And obviously that model has evolved, but it was just an awesome experience for me to not only build investment judgment, to hone, quantitative analysis skills, but also build that qualitative aspect of how do you source new investments? How do you establish rapport with entrepreneurs and build relatability between them? How do you kind of exercise that sales muscle that I think is often underappreciated, but is hugely valuable in almost any industry that you go into? And that's really what my job was. Like as an associate in a growth equity firm, it was how do you map out and understand different segments, figure out what are the interesting companies that frankly don't need money. If they needed money, they wouldn't necessarily be profitable. They might still be figuring out product market fit. But there are these rare businesses that have kind of bootstrapped their way to scale and growth and profitability. And those are really the businesses that we gravitated towards at TA. And then how do you find those businesses, reach out to them, build those relationships, and ultimately convince them to raise capital from you is just an awesome skill that I feel very fortunate to have built at that stage of my career. So I would categorize that phase as like diving deep into healthcare and then building this sourcing muscle, both of which have served me, really well, since then.
It's pretty crazy how like entire industries can be built and it's decades, it's not centuries. So like, for example, you mentioned like private equity, kind of the idea sprouting up like in the 50s, 60s, 70s, and now it's mainstream. And now it's like very well respected.
Even growth equity, right? Like
Yeah.
that traditional growth investing, the growth equity is kind of this nebulous term that means a bunch of different things depending on who's saying it. Like it could mean late stage momentum venture, but it also could mean, the same style of deals that TA really pioneered, and then Summit and Great Hill and Spectrum and all these firms have kind of have sprung up. They've been around also for decades, but have come up and been hugely successful. That ecosystem now is a very, very kind of competitive world now as well. So yeah, it's pretty interesting to learn that history.
Love it. One of my mentors in the search business educated me actually like earlier this week or last week that the search industry actually started out of Bain consulting firm. So like they started to like recommend to their clients certain hires and taking a fee for them. And then eventually they realized, like their clients realized it was a conflict of interest for Bain to, tell them, hey, you need to make hires. And oh, by the way, like we're the ones hiring for you and making a fee off of it. So they eventually had to separate those businesses. Some of the people that were doing that at the Bains and McKinseys ended up spawning off to like start search firms. And like that's how that whole industry started. And like back then, we're talking about mailing resumes in the mail.
Right.
Like everything was either on the phone or like in person. There was like no virtual, type of conversations as you could imagine.
Yeah.
And then the other piece that's like just very, very intriguing about it is as time goes on, you're going to like see that like, processes change and like how companies make hires change. So it's just a very interesting thing of like what the search industry was at the beginning and what it's become today. Very, very interesting where these companies get their origins.
Totally. And I think the tech enablement of all these industries and how technology has evolved, but then how that pendulum has swung back. I remember when I started at TA, it was like you should email all these founders because like everyone's calling them so much. Like no one ever picks up their phone, but if you
Yeah.
email them, you'll actually get in touch with folks. Now it's like, no, don't email, call them. No one ever picks up their
Yeah.
actual phone
You
call.
don't call, text.
Yeah, and then
They
text
get
it.
straight
Yeah,
to voicemail. They screen it. Like you got to text them. Like it's
of
just
course.
everything.
And now it's like all automated too. So the industry has evolved a ton.
Yeah, like people who like, taught me the business who were like doing this in the 70s and 80s and even 90s, they're like, yeah, you got a chief commercial officer search. You'd go into the yellow pages and start
Yeah.
calling companies directly because like you didn't have LinkedIn, you didn't have org structures, you didn't have software, you didn't have computers. You had to call in and be like, hey, I want to talk to the, VP of sales.
Exactly.
And they're like, why? I'm looking to buy. But it's like there wasn't another option. You had to call, right. The receptionist answered. You had to have an excuse to why you need to talk to this person. Like it was just a very convoluted business. Now it allows for a lot more transparency, which is great. So you were a principal at SilverSmith Capital Partners, joining it at its inception, and helped build the healthcare IT services side of their practice. What was SilverSmith like when you joined? And then what was it like almost a decade later?
Yeah, I would say, when I joined, it was almost a startup in its own right? Like it had a small team. I joined right after the founding partners had raised the first fund, but before we made any investments. We had just moved out of a WeWork into like an actual office. So, it felt like we were a real firm. But, we're a small team. So we all had to be really scrappy, really hungry. We had to get our name out there because I came, again, like TA has been around for decades. Not that you got amazing response, but like people kind of had heard of TA. And if you send an email with the TA domain, like people will probably be more likely to respond than a name they've never heard of. So even something as simple as building that brand, both among the entrepreneur community, our LP community, was part of the job. And it was really cool because we'd figured out a lot. We were tinkering around the edges, but at the same time, I think we really benefited from just having a lot of domain expertise, both among the founding partners and then the folks that joined, like me, where we had the only way we could differentiate was by not just being a group that's going to email every company out there, but rather really dive deep into healthcare and tech, were the two areas where we spent time as a firm, and I spent all my time in healthcare, so that when we actually did get in touch with these entrepreneurs, we would have something interesting and something unique to say relative to the dozens of other growth equity firms that were out there. So it was a really cool experience. Like the firm's grown a ton over the last 8-9 years. When we started, it was also really cool because I mentioned coming from TA, there were a few other people from a bunch of other growth equity firms, whether it was JMI or Bain Capital Ventures or Spectrum Equity. So it felt like we were kind of cherry picking all these little elements that defined a lot of these other firms are now competitors to hopefully create like a unique identity and a unique process by which SilverSmith goes about making investments. And it worked well. So kind of fast forward over that time period, now the firm has raised 4 funds. They manage over $3 billion of capital. The team has grown to single digits when I joined to they're probably close to 50 today. So I feel really proud of the time that I spent there. It's been it was an awesome experience, and I think they're going to be a world class. They are a world class, and will continue to be a world class organization going forward.
I love that. What were your greatest challenges in building like their healthcare services?
Yeah, I mean, I touched on some of that, right? It's like getting the name out and establishing that brand and building that sourcing engine that I touched on before. I touched on that domain knowledge. Like we couldn't just rely on being a very like well-known, well-established private equity firm in the early days. We had to really differentiate by having some unique perspective in healthcare and software, of course. And this isn't, as I kind of reflect back, like I don't think this was a unique to SilverSmith challenge, but as you look at that time period from 2015 when we just got started through present, like it's been a pretty crazy, time in the world, right? Just in terms of how valuations have trended, zero interest rate policies, then COVID, then the boom of 2021, and then the downturn, or whatever we're in right now.
Mhm.
It's always hard to figure out like where valuations are, how to best value businesses, and both from a micro and a macro standpoint. And then maybe the last challenge, which is more of an opportunity, was like how we played healthcare services. And I think we'll touch on this more, over the course of the conversation. But we took the approach at SilverSmith to not necessarily invest in like scaled healthcare services platforms, but to do more creative buy and build type strategies where we would partner with an entrepreneur, identify a thesis, and then go buy smaller assets in a space and build a platform over time, figuring out like what's in that box, because that's not necessarily the easiest to say, oh, it has to be this revenue and that EBITDA and that growth. So there's more creativity associated with that, which was like a challenge and an opportunity, because those investments were good investments. And part of what got me excited about the Juxtapose opportunity.
Yeah, I have to ask, when you like started at SilverSmith and you were building the healthcare vertical, essentially like the companies you were approaching were having to bet on you. Like SilverSmith didn't have the reputation in that space. So they were pretty much like, hey, I want Nikhil to be the person helping me here. Like that's the person I'm betting on. That's the person I bring value, that I'm believing will bring value to me. And eventually what you want to build from a brand standpoint is like, they want to take your money. Like they prefer to work with you, all things being equal. So I guess my question is, like, in building your brand, how much did you rely on your previous experience at TA and selling that? And how much was it like just trying to create a new brand for yourself at SilverSmith? Like how much overlap is there? And I asked that question with the experience of myself, where like I got a lot of my first customers in this market, in this like self-insured employer health plan market, because I explained like, hey, I'm doing this work for Livongo. So like, I've already proven I can do it for a tier one, very well-respected company, giving them the idea that like, hey, if I can do it for them, I can do it for you. Same type of thing where you're like, hey, I did this at TA. Now that I'm in this new brand, like, yeah, I have some different resources, but you're still getting the same guy, same capabilities.
No, it's a great question. I mean, not to give a cop-out answer, but it's definitely both, right? And the benefit of SilverSmith's culture and strategy is like everything is a team, is a team deal, right? So I certainly was able to talk about my experiences prior to joining SilverSmith, but we all were able to talk about our collective experiences at all the firms that we've been a part of. So I think being able to say, hey, we're a new firm, but the people that work here used to work at these 7 firms, and all those 7 firms are firms that you've heard of. And across our team, we've invested in these 10 companies, among others, that have been huge winners and great success stories. And yeah, we don't have the same business cards today, but you can call any of those entrepreneurs and ask, hey, what was it like to work with us? And they would tell it, they would probably say good things. So it was a lot of kind of relying on not just me as an individual, but just that collective of experience and the individuals that we partnered with in prior roles, right? Because it's not always just that company, but it's like that founder. If you call him, I'd be happy to put you in touch. That really helped. I think also then just saying, but we are new, we're nimble. And in the early days, we often said like these early investments are going to be really, really important, maybe disproportionately important to us as a firm because we're just starting out, than it would be maybe to a much larger established firm. So like we're going to be super, super invested in making this investment a success. And not that other firms wouldn't, but like this is kind of more
your reputation is on the line.
Reputation is on the
line.
line.
Successful,
totally.
You don't have a sales pitch.
Exactly.
Use me because all my experience is success at TA. And they're like, well, what have you done at SilverSmith so far? And you're like, we've had some bad ones. And they're like, were you only successful because TA?
Right.
Or like, did you transfer all of that knowledge, all of that expertise, and like create something even more valuable here?
Yeah.
So it's so interesting how all these businesses, it's all about reputation. It's all about customer references. It's all about getting referrals. I don't care if it's search, PE, VC, actual like SaaS B2B, anything you can name. Like everyone wants to know, who else do you work with? Who else is willing to say good things about you? Who else trusts you? Like it's all about that. So everything we do in our businesses, like we have to think like, is this person going to say great things about us? And if not, like how can we improve that over time? Because any customer or business relationship, it's not just going to be up and to the right the whole time. There are
Yeah.
going to be challenges. There are going to be failures. There are going to be roadblocks. It's how you handle those
Yeah.
in the tough moments that people really know what you're made of. So
Yeah.
I love that. So let's talk about the successes. You
Yeah.
did hit some really nice, singles, doubles, even a home run or two, over at SilverSmith. Talk to me about what you're most proud of
Yeah.
succeeding and
Well,
accomplishing there.
first of all, I'm most proud of just like having a small impact on a firm that's grown to become very successful. So first and foremost, it's the people, it's the organization, and it's the culture. That's something that I look back really fondly. And then, so that's kind of more firm and organizational, but also, from a healthcare standpoint, we've had a lot of successes as a firm, but it's been across a lot of different domains. So, there's some firms that only do healthcare IT or only do provider IT, or others that only do healthcare services or provider healthcare services. And looking back on the portfolio, many of the companies that I was very involved with, that I sourced, kind of seeing a mix of provider IT, payer IT, tech-enabled services, life sciences, software and services, PPM businesses, non-clinician, non-provider-based services businesses. It's been a really diverse set of businesses that we've invested in, and for the most part done a pretty good job in driving great returns within those businesses. So it's less like one specific investment and more looking back on that portfolio and looking at it as a collective in terms of all the unique experiences and the diversity of business type and end market that we were able to partner with.
Can you give me a couple examples of like where you feel you brought a ton of value to one of your investments? Like you helped them bring on a certain amount of new customers, or help them with a product pivot, or help them, introduce them to potentially the company they got acquired by at some point. Like what is some of the value where like someone who's not super familiar with private equity, they're like, what does a private equity partner do all day? Like once they write the check, like what do they do other than source other deals? Like how do they add value?
For sure. It's interesting, right? Because as a growth equity firm, in many instances, we were minority investors. So we have to pick our spots. And I think this also goes to like understanding what the strengths and weaknesses of the management team and the founders are. Like many of the founders we partner with have exclusively grown their businesses through organic means, through just organic go-to-market efforts. Many of them are product-focused businesses, entrepreneurs that never really invested in a professional go-to-market organization. Others are much more sales-driven. So we have to kind of figure out, okay, where are the strengths and weaknesses of the founders that we're partnering with, and then how do we kind of strategically fill in those gaps. So, at SilverSmith, the areas that we tended to be most helpful with was, thinking through go-to-market, thinking through M&A, thinking through kind of adding professional sophistication and just, more of the boring stuff that you can kind of get away with not having if you're a $7 to $10 million revenue business, but you kind of need when you're like a $50 million or $100 million revenue business. Those were all like common areas where we got involved. I would say that, where I personally probably added the most value was on that M&A front, because that's just something that smaller businesses haven't really done a ton of. So there are definitely businesses that we invested in at SilverSmith that were growing nicely organically. And then we did one pretty big transformative acquisition that totally transformed the business into a much bigger and more important business for that end market. And then there are others that are more roll-up in nature, where we're really the outsourced corporate development team for the companies, especially in the early days, where when you start with just an idea and a management team, but no real assets, like figuring out how to decide from a strategic standpoint where we're going to be acquiring businesses, what's in the box, what's out of the box, and then how do you build a repeatable process to do that at scale, to build a platform over time. Those are some of the common areas where, personally I was very helpful, but as a firm, we also tended to lean in the most.
Yeah, it's fantastic. What qualities and traits do you look for, in a founder CEO that you want to invest in?
Yeah, that's a good question. I think it's both at Juxtapose and at SilverSmith, we tended to gravitate towards founders that came from industry, where they might be an industry participant, recognize a pain point, evaluate the current options that are available to them to address that pain point, find that there's nothing there, and then start a business to solve that pain point. Especially in healthcare, I feel like that domain expertise and having lived it is really, really important.
So many people that like that fits that have been ultra successful.
Yeah.
Like I had Glenn Tolman on the podcast a handful of weeks ago. You know, his son is diabetic. So like he knew the pain point of a patient because he had one in his family.
Right.
Like Dan Perez and Gabriel Mecklenburg at Hinge, like they were patients. Like Dan broke his arm, Gabriel tore an ACL in judo, and they're like, the physical therapy process is not a good one for the patient. Like there's a better way to solve this.
Yeah.
So it's just so interesting that you mentioned that. And I just see like the commonalities of people I truly respect who did it at the highest level. And like they have that.
And it's not even like this personal experience, like someone working at a large health plan and recognizing that, you know, some aspect of that is broken. And then they leave their health, that nice big corporate job.
I have a good example of that. I had Elon Adler on the podcast a couple weeks ago, and he founded a company in the early stages called One Imaging right now. They are doing extremely well, but they're only, 2 years into their business. And he was a radiology salesperson at Siemens. Before that, he was a radiology tech at the Cleveland Clinic. So he saw it from the vendor perspective. He saw it from the clinical perspective. And he's like, there's an issue with how we charge for imaging, like how transparent is the pricing, like how easy is it for someone as a patient to see like what it's going to cost them, what's the quality, like all of those things. And he started a company and they're doing extremely well. So I totally get that. Like it could be a patient experience. It also could be like, hey, were you the person that maybe would have bought this or sell it or whatever? And like,
what did you need that you couldn't get? And then let's build that, right? But the other interesting thing is I think there's this tension where you need that domain experience and having lived the pain point. But the founders that I gravitate towards and the traits that I look at is also that openness and the learner's mindset, I guess, where it's like, you've been in industry, but you don't know everything that there is to know, and you're open to feedback, open to growth, open to learning. Because there are many industry incumbents that are just saying, hey, this is how it's always been done. And they aren't necessarily kind of growth mindset oriented. So you kind of need both, which is a really tough combination to find. But that's what we really look for in both, Juxtapose and, in my prior lives.
Love that. As someone who's sat on, many boards for a lot of different healthcare tech companies, can you share any behind the scenes glimpse into strategic discussions that you felt like really shaped the orgs in the early years?
Yeah. Well, I kind of touched on M&A, right? Like that's just been such a common theme in my career, and SilverSmith and TA's kind of value add lever in the sense that, bootstrap entrepreneurs don't necessarily just like know how to buy companies. And there's so many different flavors of M&A too, right? It's like you could acquire a competitor and consolidate market share and gain new customers. You could acquire a new product that's selling into the same customer base and expand wallet share within those customers. You could acquire a totally adjacent business to expand your addressable customer base and do cross-sell. You could do acqui-hires, you could do tuck-ins. So kind of mapping out those different strategic paths for M&A, not just, hey, I want to buy that company because it's interesting, is an exercise that we frequently did with many of our companies across the board. There's another example that I can think of that's less M&A focused, but equally transformative, where for a lot of provider businesses that start as fee for service, especially in this world, there's a given kind of how the market is perceiving PPM businesses, there has to be a so what, right? Like there's either a tech enablement component or a value-based care component that makes a outpatient provider business some differentiated relative to the vast landscape of other provider businesses that are out there. So I can think of a couple examples. One where we started out entirely as a brick and mortar provider business, and over time, actually precipitated by COVID, where you had to kind of have some sort of a tech enablement strategy, became a hybrid virtual and in-person provider business. Another that started out as a fee-for-service business, and then we decided to enter into more value-based contracting, both via ACO REACH directly with Medicare, and then also thinking through how to partner with MA plans to move into more of a kind of value-based care reimbursed construct from a pure fee-for-service business. So I think those types of like huge decisions were common, within many companies, but I think M&A and then kind of these business model shifts are probably some of the recurring patterns.
What inspired you to join Juxtapose as a senior principal on the concept development team?
Yeah, I mean, it was kind of what I touched on earlier, right? I mentioned one of the differentiators at SilverSmith was this approach to healthcare services, as we're not just going to buy a business that's perfect, that's perfectly optimized, that's nicely profitable and growing, and use debt and kind of tweak around the margins, maybe streamline further and try and eke out at 3 times MOIC. We're going to start much earlier, and we're going to say, hey, let's find a segment of the market that hasn't consolidated yet, or where there's some unique way to build a platform through M&A to address a pain point that hasn't yet been addressed, kind of to our point earlier. Those deals, that's probably like 20% of where I spend time at SilverSmith, and I found those to be just really interesting opportunities to be creative and a little entrepreneurial in your mindset, but also still be in the transaction and deal business, which is where I really cut my teeth. So I first, when I learned about Juxtapose, I'd kind of learned and thought of them more as a true de novo, like venture studio type firm, even though we don't like to use the term venture studio. And those are interesting businesses, but those are really, really different from what I'd been doing in the past, where it's let's come up with an idea and literally start a business from scratch from within the 4 walls of the organization. Over the last 3 years, Juxtapose has actually expanded that strategy to include what we call platform builds versus the original strategy, which we call heritage builds. Platform builds are very similar to the types of deals, those types of kind of buy and build deals that I'd done in my prior life. So I thought, wouldn't it be cool to kind of dedicate all of my efforts to pursuing theses, being 100% thesis driven, and pursuing something that's a little bit more creative, where you have a mix of buying and building. Interestingly, that definition of what's a platform build is pretty broad, right? It's not just pick your different specialty of physician and like roll up the next ology. It's a lot more than that, and it's a lot more of like, how do you acquire the ingredients and use those ingredients to kind of make something that's different than the sum of the parts, which has been a really creative and interesting experience so far. So that learning more about that strategy, feeling that it's actually pretty different than many other firms that are out there, and having the opportunity to kind of join something that feels like a new approach to private equity was super interesting to me, and what inspired me to make the switch.
I love it. How does Juxtapose source deals, on the platform builds? Because you mentioned like there's that ideation process on the legacy type deals you mentioned.
Yeah, the heritage. Yeah.
Heritage, sorry.
Yeah. So the important thing to note is that our process for deciding what company we're going to build is the same. So we have a kind of very generative brainstorming process, really, for lack of a better word, where we're constantly kind of talking to industry executives, collaborating internally, leveraging the insights from our portfolio to figure out exactly what an entrepreneur might think about, right? Like, where is there a pain point? Where is there an unmet need for a given constituency in a market? And do we have a unique way to build a solution and a right to win to really solve that problem? And depending on what we decide is an interesting business to build, then there's often a fork where it's like, okay, do we build this as a heritage kind of ground up de novo build? Or is there some sort of fragmentation that exists in the market somewhere where we could pursue more of a consolidation play to get to scale faster? And then we would do it as a platform build. So once we kind of move into that like track, I guess, the methodology for sourcing these deals is very similar to the muscle that I built in my prior firms, right? There's nothing glamorous about it. It's the elbow grease of digging through conference lists and going through LinkedIn and identifying targets. But then when we identify the targets, the outreach is way more tailored, because it's not like we're just trying to email every single company that's out there with a certain employee range, or that we think might be in a broad kind of thematic area. It's extremely targeted to say, we've spent 6 months honing this thesis. We only do a handful of these a year. Mm-hmm. And we're reaching out to you not as just a kick the tires, let's learn about an interesting business. It's because we know a ton about your sector, and we've specifically identified your business. So I think the sourcing aspect has a lot of similarities, but I think once we actually kind of get closer to having those conversations, we can start maybe a few steps ahead, because we've done a lot of thesis development in advance.
So if you have a thesis and you're deciding like build or buy, what other stakeholders are you asking about companies you're considering even reaching out to and like sharing that verbiage? Is it their customers? Is it like, who in the industry do you want intel from?
Yeah, it's as many stakeholders as possible, really. So like one good example is and relevant to your world, right? In the self-insured employer ecosystem, mm-hmm. If we're thinking through, is there an opportunity to build a next generation TPA or a tech-enabled TPA? Not necessarily the most groundbreaking idea. It's not one that we're actually pursuing right now, but to prosecute that idea, we'd want to talk to existing TPAs. We'd want to talk to the employers themselves. We'd want to talk to the brokers. We'd want to talk to the cost containment vendors. We'd want to talk to the investors in some of the TPAs. Mm-hmm. It's really talking to the entire kind of ecosystem of stakeholders, like to kind of map out, like, are people all saying the same thing? And where is the kind of supply demand imbalance in a given market? And try and kind of project like where an opportunity might lie. So that's how we think about it. Yeah, I think the self-insured.
Do you share that with the founders that you reach out to? Like when it's super customized, are you like, hey, we talked to 10 different brokerages. We talked to 5 different like current TPAs. Like
I think that's
you just are an open book.
Well, kind of like that's important to build credibility. And I don't think any founder would want like our tome of hundreds of pages of call notes and scratch ideation. But yes, in reaching out to these entrepreneurs, they, at least from my experience, they would so much rather prefer having a conversation with someone that knows their industry, that's not explicitly pitching them or selling them, but is trying to add some unique value. Some, maybe it's an insight or two. It's not only so much you can do on a 20-30 minute call. But if we're able to have some of this pre-work done, a lot of these conversations to come to these sourcing conversations with, it resonates so much more with the entrepreneurs.
Are you able to share a specific investment at Juxtapose that like this is your case study? Like this is how we like to ideate a company and hire people and grow it and add value and all these things.
Yeah. One that comes to mind is a business called Wisdom. So Wisdom is a software business that helps dental offices deal with their rev cycle and billing. And I think it's an interesting case study because it incorporates, while it's technically classified as a heritage build, it actually did involve a small acquisition to get off the ground. It also leverages AI, so it's very on theme with kind of current market trends, but also is uniquely kind of juxtaposey in the sense that we started by acquiring a services business, an outsourced billing company. And our thesis, which is not necessarily all that unique, is that AI at equilibrium will likely be augmenting humans, not necessarily replacing humans. So, if you have an outsourced billing business that is 100% services today, how do you build software to make the humans more efficient? Is really kind of the business that we're building at Wisdom. So Wisdom's like quadrupled since we started it only a couple of years ago. It's really doing quite well. But what's interesting about that business, I know you asked about the process, is the insight was really starting from the pain point. So, and this wasn't one that I personally worked on, but the team spoke to a bunch of dentists, right? And we also are investors in a dental business, so that certainly helped. But you kind of ask, like, what are your pain points around billing? And you find out that the average dentist, only collects like 85 to 90% of the revenue that they are owed, and it costs them, 6 to 7% to actually, collect on that revenue. So they're really leaving like 15, 20% of what they're owed just on the table. So the good DSOs, like that's a mom and pop perhaps kind of dental practice, but like the good sophisticated DSOs both collect a way higher percentage and pay less to do that because they're at more scale. So we know the problem can be solved. So how do you kind of think about like solving that first principles problem through a unique approach to technology and a unique approach to kind of solving that labor shortage? Because what it really comes down to for a smaller independent dental practice is they just can't find the people. So if you can add some automation to that, that should hopefully solve a pretty big pain point within the industry. And a lot of the other outsourcers today don't really use that much tech enablement. That'll surely change, but we think we're an early mover in that space. So Wisdom's been a really cool one to track, and it's been an early success for the firm.
Love it. You work closely with firm portfolio CEOs. Like, how does Juxtapose partner with these portfolio companies, and how are you finding these CEOs?
Yeah. So a lot of this starts with our concept development process. So we don't engage necessarily with the CEO search until we're well deep within forming a new concept, and that can often take 6+ months to get to that point. But a lot of that is kind of what I touched on earlier, which is like, what is the typical CEO profile for a Juxtapose business? That is someone that's come from industry, that's had experience with private equity, that might have run a large division within a public company, that has been around the block a few times to know where the industry pain points kind of really resonate with them, and where they feel like our process of starting with the problem and then kind of digging down to figure out what's the unique solution that we can build, like really resonates with them. So as we kind of nurture an idea along that process, we'll engage with industry executives under the context of an advisory relationship, potentially a future board relationship. Sometimes those can actually become like founding CEO relationships. Oftentimes, though, we're just trying to kind of network and build more knowledge around a given idea as we're advancing it within the pipeline. In many instances, though, it's really working with firms like yours, right? Which is engaging with search firms, but we'll have a very, very specific kind of profile of CEO that we're looking for. We have an awesome talent team within Juxtapose that also leverages their own relationships to help find the best CEOs for the companies that we start.
When you in your firm decide like, hey, this is a market we want to go after, where do the ideas typically come from? Are you reading a ton? Are you going to conferences? You're just constantly talking to other investors? Like your pie chart of like where the idea came from. What would you say percentage-wise? Like,
that's a really good question. I should ask that question internally because I don't have that pie chart kind of like right off the cuff. I mean, a lot of it's what you said. We're talking to like people that are way smarter than we are as often as we can. We're attending relevant industry conferences, and it's less so like the big ones that everyone attends and they're kind of big parties and they're fun. Those are fun, but it's the smaller
ones that don't have like some celebrity performing on stage, like at the
exactly. Exactly. Like not that.
Those are incredibly fun and very valuable to some people.
Exactly, but it's this very industry specific nichier conferences that are relevant to a thesis that we're working on that might have 100 exhibitors, not thousands. So it's going through that. Also sitting in the sessions, like I feel like in my prior role, it was always like, let's talk to as many companies as possible. In this case, it's definitely let's talk to as many companies relevant to a thesis as possible. But it's also like, what are the big public company CEOs saying about key initiatives, key problems that they're encountering. So it's a lot of that type of
How
interaction.
much is it following policy, like government policy?
Yeah, it really depends on the dig, right? I think sometimes it's very focused on that, right? Like if it's a value-based care project that we're working on, like understanding the implications of V28 are really, really important to a lot of our value-based care oriented businesses. In the life sciences world, like I'm spending some time in the clinical trials world right now. The FDA is making a huge push towards having more, diversity in clinical trials. So how do you think through how to play that theme? Is that a theme even worth playing, or
Yeah.
is there a different way to approach clinical trials? So there's definitely a lot of focus on the regulatory environment. At the same time, anything that's so highly tethered to the regulatory environment might not necessarily be the best idea. Like depending on who's in Washington, like that's
Way
not
higher risk that
where
4 years later, 2 years later, like
exactly. So it's
changes.
impossible to escape in healthcare, but you also have to make sure that it's a risk that you can effectively mitigate.
When you're evaluating like whether to build a company in a certain sector, what's a red flag that if you find it, you're like, okay, everything else could look great, but like that's a deal breaker. Or like the top ones where you're like, these give me major heartburn and pause.
Yeah, well, one is maybe a little bit like contrarian. If you talk to a lot of businesses in a given segment and they're all like 50% EBITDA margin businesses or more, like that's maybe a red flag. That's maybe a yellow flag. It's like why is this segment earning so much especially in healthcare? It's like it's really hard to build super profitable businesses, especially in like healthcare services. Maybe in some enterprise SaaS segment, a vertical SaaS business where you don't have to invest a ton and go to market and you build just the best mousetrap out there, you can get to some really solid profit margins. In
It's like
healthcare services,
it's like Bernie Madoff. It's like, oh, they're getting 30% year over year. You're like, at a certain point, it's too fishy. It's like no
yeah,
one can do this consistently. So like something
exactly.
must be up. If it's too good to be true, sometimes it is.
Yeah, I mean that's kind of a yellow flag, right? Like that,
Yeah,
not to kind of be negative on profit. That's obviously important, but it
yeah.
also then implies like, okay, how are they pricing? Is pricing sustainable? What are the
Mhm,
supply demand dynamics in that market? What are the competitive dynamics in that market?
mhm.
And what will that look like in 5 or 10 years? Because we're always, of course, it's like what's the market going to look like later, not necessarily today. So I would say that that's like one thing that kind of raises my eyebrows a little bit.
Okay. What areas in addition to dental has Juxtapose like spun out companies for, just so people are aware of what you think are some of the areas that are, underserved, undervalued, where a
Yeah,
lot of innovation can happen?
yeah. Well, that's a really good question, and the answer is slightly different based on what we've done and what we're doing.
You're not going to tell us what you're doing, otherwise that might give away, some of the moves Juxtapose
Yeah,
might make.
well,
You want
it's
that first mover advantage.
interesting. Like, in my prior roles, I'd never say, "Hey, I'm pursuing this business," right? Like that. Then that's very obvious. But I'd be happy to talk about like high level themes because it's
Great.
so much more in the execution than the
Mhm,
idea, right? Like the actual idea, like, oh, we should build something in clinical trials, like
mhm.
cool. Like, what is that going to be, and how are you going to do
Yeah.
it, and how's it going to differentiate? So, where we spent time at Juxtapose within healthcare has been, we've done a little bit in healthcare IT. Wisdom's a good example of that. A bunch in, outpatient provider businesses. We're investors in a company called Tend, which is a dental, a DSO, kind of the fastest organic growing DSO in the country today. A couple of value-based care businesses, one called Herself Health, which is focused on women over the age of 65, one in the pediatric space. So it's been a lot of provider and provider tech businesses
Mhm.
um, historically. I think going forward, it'll be some of that, but certainly it'll be more in the payer world, more in the life sciences world,
Mhm.
more in the self-insured employer world. So those are where I want personally, where I'll be spending a lot more time will
Mhm.
be probably less so in the provider services, provider IT world, and more in the payer employer life sciences world.
All right, so sounds like we're going to be talking more often than we used to.
Yes,
I'm
I
signing
agree.
up for that. So I ask everyone who comes on this podcast, like, how do we practice what we preach? Like, how do we live wellness ourselves,
Yeah.
as people, not just like as our profession? So how do
Yeah.
you in a stressful job eliminate stress, like stay healthy mentally and physically to be able to perform at a high level?
Yeah, that's a great question. I'm glad you're asking that. Yeah, it's a stressful world, isn't it? Yeah, for me, the best, let's start with like physical health. Like I'm
Mhm,
not, I'm like a weekend warrior, like endurance athlete in the sense that like
mhm.
I love running and cycling, but I'm not particularly fast at either. But I think exercise is just the best way to both be, physically fit, but also reduce stress. So
And you only exercise on weekends? You don't have time during the week to fit it in,
no, I
or?
mean no, I do have time during the week, but I would say that my skill level is probably akin to someone that only exercises
Gotcha.
on
Okay.
weekends. So I'm not trying to break any speed records here, but definitely getting out and exercising and being outside, and especially regardless of weather. Like we live up here in the Boston area, and like even going for a run when it's like pretty cold outside, like
Yeah.
there's no such thing as bad weather, only bad clothes. So that's something I've been doing. And then I do try and read a lot, like physical books with no screens. I found that if I do look at screens actually pretty close to bed, I can't sleep, and that kind of messes up my day.
Mhm.
So yeah, I would say that like just getting out, exercising, and getting away from technology every now and then can be hugely helpful in just general wellness.
Yeah, I think us that live in like the northern half of the US, like you got to get outside in the winter, like
Yeah,
even if it's cold. Like I take
yeah,
Luna, my 75, 85 pound black lab, in hikes, hour-long hikes, like in the winter, Saturday or Sunday, like when the snow is like a foot like high and you can hardly see her other than her ears and her head. And like she loves it. And it's great. And like it's still very sunny. You got the whole place to yourself. It's not super cold as long as it's not like wet. It's great. So it's important to like just get out and do things, even though it's not perfect and Mother Nature's, throwing a wrench in your plans. Last thing I ask everyone is I think a really hard thing in the US is healthy eating.
hmm,
We've got fast food everywhere. You're constantly being marketed to. A lot of health foods are marketed as health foods, and then you find out they're not healthy whatsoever.
yeah.
So, how at your home do you and your family like? Do you have any specific recipes that are maybe like weekly or monthly go tos that might inspire someone to try something new that works for you?
Hmm. That's it. Yeah, these are really interesting kind of
I've been
closing
asked to
questions
do a
here.
digital health cookbook
Yeah,
from all the people that have, chimed in with some cool things that people
y-
want to try. So that's in the works. Maybe 2025 will come out
yeah,
with a
sounds good.
heavyweights cookbook.
Yeah, well, we've tried to cook from home a lot more for all the reasons that you just mentioned. And I have three young kids also. So my approach to cooking is like, how can I cook the most quantity of food that people will actually eat, that's healthy and tastes good, that is like relatively cheap and quick to put together. So when you
Mhm.
do that, it really narrows the universe to like a bunch of like healthy stews. So, and it's like pick your cuisine. So I do like a kind of Thai salmon stew with some greens and quinoa. I'll do like a Burmese chicken stew with chickpeas and chicken and some really nice spices. I'll do like a turkey chili, but then I'll like chop up spinach like to really, really small pieces and sneak it in there so that my kids will actually eat it. It's basically like how many different ways can I combine some protein, some vegetables, and like some healthy carbs in as quick and efficient a way as possible. That's my
Well,
strategy.
for all of us parents, I think the easiest thing to like sneak vegetables in your kids' cuisine is to puree them like into a sauce.
Yeah,
So you make a Thai curry, like you have some like sweet potato or pumpkin or even regular potato and like blend it in
yeah,
carrots, squash. If you just blended it into the sauce and then there's like meat and sauce,
yeah.
they just eat it, not
I love it.
knowing that like, oh, you have like four vegetables in there. So
Yeah.
again, Nikhil, thank you for joining us on the Digital Health Heavyweights podcast. Really enjoyed the episode. really excited for what you're building at Juxtapose and can't wait to see, a lot of the success stories that spawn off from it.
Yeah, thanks, Norm. Really enjoy the conversation as well. Thanks for having me, and yeah, look forward to working together, going forward.
Absolutely. Take care.
All right, thank you.
Thanks. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.